Hello, everyone. Good afternoon, good evening. Welcome to the Functional Solutions podcast, brought to you by the American Academy of Functional Health. I'm Dr. Sarah, and I'm joined by my amazing co-host, Dr. Chill. How you doing today?
I'm great. How is everybody doing? How are you doing, Dr. Ellis? Good to see you
Doing
again.
good. Good to see you again. It is Wednesday, hump day, so I'm doing good. Can't complain.
Happy podcast day,
That's right. Favorite day of the week.
right?
So glad to have you all with us tonight. As you know, each week we join you all to explore practical science-based strategies to help you elevate your patient care and to advance the field of functional medicine. And this week we are taking a deeper look into the root cause medicine approach to addressing chronic fatigue. So, chronic fatigue is a condition that can be quite complex and difficult to manage and support patients with chronic fatigue. So, we wanted to choose a topic that would be pretty relevant and prevalent for your patient population. So, let's take a look at some deeper reasons as to why we chose this topic. Let's take a look at our first image of the night. Where we can talk about the prevalence of chronic fatigue. Now, chronic fatigue actually impacts quite a few Americans, anywhere from 800,000 to 2.5 million. Now, this number of patients that are experiencing symptoms of chronic fatigue syndrome, that's more than the population of the following states: Alaska, Vermont, and Wyoming. So, just take a moment to think about the number of people that are affected by this debilitating condition. We also want to point out that the prevalence by gender is pretty stark. For every 100,000 women and 100,000 cases, more women are diagnosed with chronic fatigue syndrome than men. And so when we look at the economic impact of this condition, it costs our economy billions of dollars every year. And unlike normal fatigue, chronic fatigue syndrome does not get better with rest. And oftentimes it requires a deeper look into the root of that patient's condition. So, like I said, chronic fatigue is more than just feeling tired. It is a persistent, overwhelming exhaustion that does not improve with rest and significantly can impact your patient's daily life. Let's take a look at the next image that will help us see all of the different ways in which chronic fatigue can impact our patient's body. So patients can present with a variety of symptoms. Let's start from the head and work our way down. So they could oftentimes, patients with chronic fatigue syndrome present with difficulty with thinking, information processing, cognition, memory, and concentration. Often, interestingly enough, they'll have a sore throat, may often have difficulty breathing or some breathing challenges. Um, Interestingly enough, with the cardiac system and the circulatory system, it can impact the vagus nerve. And I'm sure you all have gone through the platform and logged in and looked at some of our lectures that talk about the vagus nerve. But you may recall that the vagus nerve innervates many different organs, but does play a role in our heart rate, as well as our rate as well. And so chronic fatigue syndrome can impact that as well. It can lead to GI issues, renal or kidney issues, and oftentimes one of the most common complaints associated with chronic fatigue syndrome is joint pain. So often joint pain, muscle pain, and the onset of fatigue often after exertion or stressful situations. So it's like I said, chronic fatigue is not a standalone condition. Instead, it's a symptom of a deeper imbalance in the body. And this week, we are going to take a look at some of the root causes behind chronic fatigue syndrome. So we're going to discuss vitamin deficiencies and their correlation with chronic fatigue syndrome. We'll take a look at mitochondrial dysfunction. So when the patients are having issues that lead to damage to the mitochondria, that can develop and turn into symptoms associated with chronic fatigue syndrome. And then lastly, we'll look at endocrine imbalances. And so, how do our hormones play a role in the development of chronic fatigue syndrome? So, let's get ready for our first quiz of the evening. Which of the following key characteristics differentiates chronic fatigue syndrome from general fatigue? If you all are watching live, hello. Please leave your answer down in the comments. And if you're watching on the replay, participate as well. We'll love to see your answers. All right, option number 1, fatigue that improves with rest and resolves within a few days. B, persistent unexplained fatigue lasting more than 6 months and worsened by exertion and not relieved by rest. C, fatigue primarily caused by lack of sleep or overwork with no other systemic symptoms. Or D, fatigue that is only present in individuals with a diagnosed autoimmune condition. So again, the question is, which of the following key characteristics differentiates chronic fatigue syndrome from general fatigue? And the answer is B. Chronic fatigue syndrome, also known as myalgic encephalomyelitis, it's quite a mouthful, is characterized by persistent and debilitating fatigue that lasts over 6 months, post-exertional malaise, cognitive dysfunction, and unrefreshing sleep. Those are all symptoms that make up the cluster of symptoms or that make the syndrome chronic fatigue syndrome. Now, unlike general fatigue, it does not resolve with rest and is often accompanied by immune, neurological, and autonomic dysfunction. Dr. Chill, how have you addressed chronic fatigue syndrome in your practice? Have you seen it a lot with your patient population?
It's so interesting that you pulled up those statistics because I think in the functional medicine space, it's higher than that.
Yes.
I think the majority of our patients have chronic fatigue syndrome as part of their symptomology, right? And honestly, I probably see when I was seeing patients, about 90% of my female patients would have some sort of chronic fatigue marked off in their intake form. And that's why one of the reasons why they were coming in. About 80 to 90% of my male patients had that as well. So it's slightly skewed in the functional medicine space, I think, because we deal with more of those complex issues. And so many more of our patients are dealing with chronic fatigue because they're not being helped by their other doctors.
Exactly.
A lot of times it's medications being thrown at them, antidepressants, anti-anxiety medications, right? And they're trying to figure it out. So that's why they're coming to us. So I'm really excited about this talk today.
Me too. Me too. So let's jump right on into that first root cause. Can you tell us how nutritional deficiencies can lead to chronic fatigue?
Absolutely. So most practitioners understand that fatigue is often associated with a couple of different vitamins, right? The main ones that people understand are vitamin B12 deficiencies and then iron deficiency, right? Because that is responsible for iron deficiency anemia and then also vitamin B12 anemia as well. So those are like the main types of vitamin deficiencies that many practitioners are aware of. However, in the functional medicine world, we dive even deeper into nutrient deficiencies because they're a main part of the chronic conditions and the root causes and the contributing factors to the chronic conditions, especially with chronic fatigue syndrome. Vitamin deficiencies, it's well documented that it's a contributing factor to chronic fatigue because if you don't have enough vitamins, whether you're deficient or insufficient, then it can impair your energy metabolism, it can impair your mitochondrial function, and then even your neurological health, just to name a few, right? So what happens with vitamins is they play a major role in energy production. And then the deficiencies in those, or the insufficiencies of those, are going to be linked with increased fatigue, causing, when it happens chronically, chronic fatigue, and then worsening symptoms of other issues as well. Now, as I was stating, we understand B12 and iron deficient. What I want to talk about today is vitamin D3, because there's a majority of us that are deficient, and your patients are deficient as well. And what we're finding is that many patients who have chronic fatigue syndrome have insufficient levels of vitamin D. So let's take a look at a study published in the Journal of Nutrition. So this was published just last month, and it involved measuring vitamin D levels of patients who developed myalgic encephalitis. Again, that's a mouthful, and chronic fatigue syndrome, or chronic fatigue syndrome. I'm just going to continue to say CFS, or chronic fatigue syndrome. And this is after COVID-19 vaccinations between August of 2022 to February of 2024. What happened with this were the participants took 25 micrograms. This is equal to 1,000 IUs. As functional medicine providers, we usually use IUs with vitamin D levels. So again, it's 1,000 IUs of over-the-counter vitamin D supplement, and this was for 6 months. What they found was that 27 of the 28 patients were diagnosed with chronic fatigue syndrome. They were insufficient or deficient in vitamin D with an average level of 16 nanograms per milliliter. And we can see in this image here that vitamin D levels are not only responsible for energy, right? But deficiencies or insufficiencies can lead to inflammation that we're seeing on the top there, depression, neurodegeneration, insulin sensitivity, cardiovascular risk, cancer risk. How many of those things and how often are you seeing patients with one or multiple issues related to that? So the vitamin D deficiency is something that you're going to want to look into if you have a patient that is coming in with fatigue, inflammation, depression, neurodegeneration, insulin or blood sugar irregularities, circulation issues, cardiovascular risk, right? Cancer risk. These are the things that we want to look into as functional medicine providers, and nutrient deficiencies is going to be a main part of that. Now, what occurred when we properly supplemented those patients was that there was a significant improvement in 23 out of the 28 patients. So this was 82%. They no longer met the requirements of chronic fatigue syndrome in the diagnostic criteria after that therapy. And then among some of the symptoms, the sleep problems showed the most improvement, followed by autonomic symptoms by about 68%. And because nutrient deficiencies is such a major part of the functional medicine approach, you are going to learn more about the impact of micronutrients, the deficiencies or insufficiencies of those, what they look like in the clinical settings, along with vitamins like vitamin D in our advanced and clinical functional medicine program. So make sure you go back into those modules and start learning about those micronutrients. And a big part of that is going to go into mitochondrial dysfunction with nutrient deficiencies, which can also lead to chronic fatigue syndrome. Is that what you're seeing in your practice as well? And so,
Yes, it's funny. We were having a conversation about mitochondrial health and cellular health earlier, my partners and we were just talking about how um, there are a lot of secondary ways that we support mitochondrial health. So we can do that exactly through replenishing depleted nutrients, by supporting hydration, all of those things. So I think sometimes we get so focused on special protocols. I need a
mhm,
special mitochondrial support protocol,
right.
when really some of the foundational things that we teach our patients to help improve their health will subsequently improve their mitochondrial dysfunction.
Going back to basics. I always
Yes.
love
Yes.
basic biochemistry in functional medicine and going back to basic approaches in functional medicine.
Exactly. And that's exactly where we're going. I am taking you all right back to biochemistry days, where we all learned that the mitochondria is the powerhouse of the cell. And that is so important, particularly when it comes to supporting patients with chronic
Mhm,
conditions and chronic diseases, because our mitochondria are very sensitive to different toxins, different stressors, and patients with chronic health and chronic diseases tend to be more overwhelmingly exposed to things that can damage their mitochondria. Our mitochondria is responsible for generating ATP, our primary mode of energy for our bodies. And so, of course, we have to start with a quiz.
mhm.
So, again, let's start to put the pieces together and begin to see how mitochondrial dysfunction can tie in with chronic fatigue syndrome. So, which of the following symptoms or conditions are associated with mitochondrial dysfunction? A, chronic fatigue and muscle weakness. B, brain fog and cognitive decline. C, hormonal imbalances and metabolic issues. D, irritable bowel syndrome, or E, all of the above except for D. So take a moment, think about it. Um, let's see. The answer is D, excuse me. So D um, oh, sorry, actually, it is E. I was looking at my notes wrong. All right, so it is E, all of the above except for D. So, mitochondrial dysfunction can lead to chronic fatigue and muscle weakness. And we'll talk a little bit more about that in just a few moments. Brain fog and cognitive decline. That completely makes sense because we need our mitochondria and energy to process so many different things, really everything in our body, including making sure our neurons are firing properly. As well as hormonal issues and metabolic issues can be associated with mitochondrial dysfunction. So, this kind of goes back to what we were just saying, dealing with and supporting patients with mitochondrial dysfunction really just takes us back to the basics to support a patient's health and well being. So, let's take a look at this next picture. This picture is from the International Journal of Molecular Sciences, from a study that was published in 2024. And it looked at coenzyme Q supplementation, or CoQ10, and how supplementing that nutrient can support mitochondrial dysfunction. So this image is really great because it highlights the many different ways that mitochondrial dysfunction can show up in a patient. So let's start on the left and kind of work our way around. A patient with mitochondrial dysfunction can show up with skeletal or musculoskeletal issues. So oftentimes that's going to look like post-exertional fatigue, myalgia, joint pain. When it comes to the heart, oftentimes patients with chronic fatigue syndrome will actually have tachycardia. They'll have orthostatic intolerance. So they're going to be one of those patients that find that they can't stand up too quickly or get up too quickly without feeling dizzy. Hypotension and dizziness as well. Now, the symptoms around the brain and how mitochondrial dysfunction can impact the brain are really interesting. Keep these in mind when thinking about patients that are presenting with chronic fatigue syndrome, or maybe that's their underlying condition. So, an unrefreshing sleep. If you have patients that tell you, I can sleep for 10 hours and still wake up tired, that should key you into supporting the mitochondria. Anxiety and depression. So many mental health conditions can be associated with mitochondrial dysfunction, as well as brain fog, headaches, and inability to manage their temperature well. Of course, GI symptoms are involved with mitochondrial dysfunction. So, again, when patients are presenting with GI concerns, you want to include something in your protocol to support the mitochondria. And same for the immune cells as well. If our mitochondria are being damaged, they are likely to lead to difficulties defending ourselves against pathogens. And so when our mitochondria are impaired, the energy that our body is able to produce is decreased, and that leads to widespread fatigue. Oftentimes, patients will present with brain fog as well and muscle weakness. Now, secondary mitochondrial dysfunction can occur again when I was saying that some patients can be exposed to different toxins or environmental factors that can disrupt the mitochondria. Oftentimes, those are secondary causes of that dysfunction. And so those factors can include a viral infection. You oftentimes will see post-viral fatigue syndrome in patients who are just recovering from an illness. Toxin exposure, environmental stressors, vitamin deficiencies, as Dr. Chill mentioned just a few moments ago, as well as gut dysbiosis and many more. So take a moment to think about how many patients you see per week with these issues and complaints. I mean, it's only Wednesday, and I can think of a number of patients that presented to my clinic who had those very same things: obvious nutrient deficiencies, gut issues, and fatigue. So there are a lot of instances that can indicate that we should support the mitochondria. So, one of the root causes of the widespread and broad symptoms associated with chronic fatigue is the fact that a disabled and impaired mitochondria makes less ATP. This increases our oxidative stress, which we talked a bit about last week. And it can also impair our detoxification and waste removal processes. So our body is kind of holding on to toxins and things that are meant to be removed from the body. That can lead to inflammation, particularly neuroinflammation as well. Now let's take a look at a study. This is a 2021 study that investigated the impact of both CoQ10 and NADH on chronic fatigue symptom relief. Now, this is a randomized controlled trial that consisted of 207 chronic fatigue patients who were supplemented with 200 milligrams of CoQ10 and 20 milligrams of NADH. And they took that every day for 3 months. One group got the supplements, the other group received a placebo. What they saw here is that over the first 8 weeks, they did a baseline level of their fatigue symptoms and their severity. Then they measured it at 8 weeks and again at 4 weeks after treatment. And what they found is that there was a significant improvement in their perception of fatigue, the health-related quality of life, and their sleep quality. Now, as we've talked about today, there are a number of causes of secondary mitochondrial dysfunction. And in our advanced and clinical functional medicine program, we explore these causes in greater depth, along with many, many others beyond what we've discussed so far tonight. Now, CoQ10, we often will recommend it for patients who are also on a statin. And so that also kind of lies in with the importance of supporting the mitochondria and also the impact that certain medications can have on the health of your patient's mitochondria as well. Dr. Cho, what are some of your go-tos for supporting mitochondrial health in your patients?
Honestly, it's what we talked about earlier, right? Going
Yeah.
back to basics. And what you'll find a lot of times when we're discussing all of these different factors, they're related and they're
Yes.
connected. And so oftentimes, if you address one of the three factors or two of the three factors, the other factor will also be addressed. And that's no different with mitochondria dysfunction, right? So a lot of times we see nutrient deficiencies as a main contributing factor of mitochondria deficiency or mitochondria issues, right? You
Yeah.
you spoke about one, CoQ10, vitamin D3 is another one, obviously B12 and iron, right? And so if you are addressing those issues, you're going to also address mitochondria imbalances. And then the other factor, which I'm about to get into, is going to be an imbalance in your endocrine system, right? This can also cause issues with the mitochondria imbalances, or even nutrient deficiencies can cause
Mhm.
endocrine imbalances and vice versa. A lot of times these factors are correlated and can cause a vicious cycle with each other. Now, with endocrine imbalances, how is this related to fatigue? In particular, what we're talking about is going to be the HPA axis. This is your hypothalamus pituitary adrenal axis. We often bring this up, often associated with blood sugar and then also energy levels. What occurs with HPA axis imbalance, especially with chronic fatigue, is that there are imbalances in the cortisol, in particular, low cortisol levels, that can trigger imbalances in blood sugar and glucose levels, in particular, low glucose, and this can lead to fatigue. Let's take a brief moment and we're going to revisit the endocrine biochemistry. I know you guys are all panicking because of biochemistry, but this is going to be a very, very simple explanation of biochemistry. So here, what we're seeing here in this picture is that when we have elevated levels of cortisol, this is going to trigger our liver to begin the process, what's called gluconeogenesis, right? On the top left-hand side in the red there. During gluconeogenesis, the liver is making more glucose to provide energy for our muscles and our brain. And then the balance of between cortisol and glucose, this is all controlled by the HPA axis. And that is your hypothalamus pituitary adrenal axis. And this is important because if that is imbalance, it can throw off your blood sugar. It can throw off even your muscle, your ability to gain more muscle. That can that can throw that off as well. If you're a practitioner where you like to have visuals with your patients, what I would recommend is utilizing some of the visuals that we incorporate in here, right? And start to explain this to them as to the hows and whys with your patients. And this is the hows and the whys as to why you're looking at their endocrine system, in particular their cortisol levels, and how it's related to their liver, their blood glucose, and their fatigue levels. So you can connect all of those with this image here. Now, another image that I want to show is what a cortisol should look like. So this is showing what cortisol levels are at on the left-hand side, right, on the y-axis. And then on the x-axis, you're seeing the time frame. So in the beginning here, you are seeing that in the morning time, cortisol levels should be at peak. So in between 6 a.m. and 8 a.m. is when cortisol levels should be at their peak. So it should spike around that time and start to decrease all throughout the day, in the afternoon, in the evening, so you can sleep. And then it should start to creep back up and then peak again at 6 to 8 a.m. What we're finding oftentimes when we test cortisol levels, and the importance with testing cortisol levels is that you want to test them from a functional medicine perspective throughout the entire day, not just doing a cortisol AM in the morning time. That's not going to give you enough information as to what is happening with their HPA axis. What we like to look at is a cortisol times 4, where it's measuring the levels in the morning time, in the mid-afternoon, in the evening, in the evening time, and then at nighttime. So we see exactly what's happening and what the patterns are of their cortisol. And what we will typically see with chronic fatigue syndrome is what's called a flatline cortisol. And what that is showing is where instead of that curve going, peaking at the top and kind of going down, it's kind of bottomed out at the bottom. And you'll start to see that when you start to do the different cortisol times 4, or what's also called an adrenal assessment with your patients. Now, I just mentioned the answer earlier, so this quiz should be pretty easy. And hopefully this is not giving you any palpitations or spiking your cortisol levels. So this next quiz question, this is related to how your patients present. So if you have a patient that comes in with low cortisol and a flat cortisol curve, what I mentioned earlier, how would you expect them to present in clinic, right? Number one, they're going to feel warm and fuzzy, and this is going to be due to less cortisol, or they're going to be tired due to the lower blood glucose, which often happens with a flatline cortisol. I literally just gave you the answer. And then 3, none of the above. I will give you a second, even though I just gave you the answer. All right, if you answered 2, they are tired due to lower blood glucose. You better have gotten that correct. That is the correct answer. So now that we are aware of the different factors that are associated with chronic fatigue, we want to supply you with the different strategies that we would use in a functional medicine setting with supplements and different recommendations to help with chronic fatigue.
Wonderful. Thank you for walking us through, taking us back through the Cori cycle again.
Right?
Flashbacks.
In med school, you were like, oh,
yes.
yeah, it's coming back. Luckily,
Exactly.
that was an easier one than some of the biochemical pathways that we studied.
Oh gosh, truly, yes. I'll take the Cori cycle over many others any day.
Any day.
So now that we have discovered, we've talked about the 3 main root causes associated with chronic fatigue syndrome. So nutrient deficiencies, as I'll talk about in a few moments, there are quite a few nutrient deficiencies that can be correlated with chronic fatigue syndrome, but vitamin D, we talked about, there's quite a bit of data supporting the use of vitamin D to support patients with chronic fatigue syndrome. Number 2, we talked about supporting mitochondrial dysfunction and the different symptoms that can show up that are directly tied to mitochondrial damage and dysfunction. And then Dr. Chill just walked us through the ways in which our hormones and our endocrine system can play a role in the development of chronic fatigue. And especially talking about the connection between cortisol and blood sugar and fatigue and energy. So now let's talk about what to do. So now you have these patients that are presenting with chronic fatigue and many other symptoms and conditions. So what's next? So let's talk about some strategies. I wanted to take a moment. Let's look at this next image and look at some other nutrients that are involved in energy production, and having a deficiency in some of these can exacerbate that fatigue and kind of transition it into that chronic fatigue syndrome. Now, I won't go through all of these, but let's start at the top and then make our way around clockwise. So at the top, these 2 are more so minerals, but chromium and zinc do play a role in glucose levels, balancing those, as well as supporting our immune system. Asparagine is an amino acid. So making sure that your patients are getting enough, not just the branch chain amino acids, but most amino acids in general, especially the essential ones, and getting good quality protein as well. Biotin, glutamine, CoQ10, which we talked about today with regard to mitochondrial support. Magnesium, we're down at the bottom around the 7 o'clock, 6 o'clock position. Antioxidants, as we go up on the left side, here are some of the major vitamins. So vitamin C, A, E, D, and of course, many of the other B vitamins all can help support patients with chronic fatigue. Now, in the functional medicine approach, there are many different factors that can contribute to fatigue. We talked about three of them today, but there are obviously more factors. And unfortunately, they are not taught in our conventional medical and nursing schools. And that leads to, unfortunately, millions of patients continuing to struggle with fatigue and other chronic diseases. So let's talk about a couple of supplements that you can incorporate into your practice and into your protocol to better support patients with chronic fatigue syndrome. Now, as we're preparing to talk about those two supplements, I wanted to make sure that I take the time to, highlight the fact that the number one reason why healthcare practitioners are joining our advanced in clinical functional medicine program is because this is one program where we are teaching you how to advance your skills in the root cause approach and how to learn specific treatment strategies that can transform your patient's health, and also supporting their nutritional goals and wellness goals as well. So, Dr. Chill, what is your kind of go-to product for supporting chronic fatigue patients?
Yeah, I'm actually going to be speaking about that. But before I do,
Yeah.
that chart that you just showed, I
Yes.
love that chart. So can we pop that up again? It
Yeah.
was
Yeah. Let's do
the
that. Isn't it
fatigue
so
chart.
good?
And so I wanted to bring this up because for the practitioners listening right now, I use this so often when I was speaking with my patients, when you're in person, or let's say you're doing a virtual visit, right? What you could do, I love doing visuals as we're doing right now. What you can do when you're explaining things to your patients is pop up visuals like this. So if you're discussing fatigue, vitamin deficiencies, or the nutrients that are responsible for energy levels, you might want to pop up a handout like this. Where can you find this? This is found at SpectraCell Laboratories. So you could either, I don't think you need an account with them to get this handout. So just go to spectracellaboratories.com. And we don't have any association with them, but they have some great handouts that you can use for when you want to explain different conditions and the whys and the hows around those conditions for your patients. But SpectraCell Labs, this is a great one to explain fatigue. Sorry about that, going back to that information.
That was
But
great.
Dr. Sarah was asking me about the question. Did you use that chart a lot as well? Obviously, you
Yes,
showed
yes.
this.
A long time ago, I don't know if they still offer this, but they printed them, and so you can hang them up on your wall in the practice. And so, patients love being able to say, "Oh, okay, wow." So there is lots of benefits to taking a good multivitamin, and yeah, there definitely are.
Exactly, exactly. I love those kinds of visuals, and your patients will as well. And so, speaking of some of the nutrients that are needed for fatigue, let's go into one of both Dr. Sarah's and I's favorite ones. It's CoQ10. Dr. Sarah mentioned this in the mitochondria imbalances. One of the major contributing factors is going to be CoQ10, especially if your patient is taking statins. One great CoQ10 supplement that I actually have used myself, I often will recommend this to my patients as well, is the nano emulsified CoQ10, and this is by Quicksilver. I like the taste of it. Most of my patients will like the taste of it as well, but it is like a sweet, tangy, orangey kind of taste to it. So that's something that you want to recommend. You should probably try it out before you recommend it to your patients as well. But CoQ10 is great for cellular energy production, right? All dealing with the mitochondria, and then antioxidant protection. And then this is particularly in the heart. So this is really great for the cardiovascular system, the circulatory system. And then with this CoQ10 supplement, it's the crystal dispersion. This is going to be a really great carrier to bring CoQ10 into the cells. And it's more important than choosing between ubiquinone or ubiquinol with CoQ10 is actually what type of carrier it's in. And this nano emulsified is actually really great. And some of the clinical studies are strongly supporting the ubiquinone's effectiveness in improving heart health and reducing cardiovascular disease risk. And one that you can recommend for your patients is the one by Quicksilver. Dr. Sarah, did you have another supplement that you wanted to discuss with the practitioners?
Yes. I'm so glad you shared that CoQ10 product. One thing that I really love that we talk about in the program is the quality of supplements and different formulations, and why something in a nano-emulsified formulation is a bit better for absorption and bioavailability than a tablet. So I'm glad that we cover that for folks.
We're sounding like a commercial for them right now.
I know, right?
But I mean, I love these supplements. So, and again, we don't have any affiliations with them. These are just the ones that we often will use with our patients.
Exactly. Yeah, for sure. So for me, on my end, I'm a clinical herbalist, so I love herbs. And when patients come in with, fatigue and difficulty maintaining energy and stamina, I usually go for adaptogens. And I tend to reach for the more stimulating ones. So Eleutherococcus senticonosis, I think I pronounced that right. It is our Siberian ginseng. So ginseng, there are two types, Siberian ginseng and Panax ginseng. They're both very stimulating. Well, not very stimulating. They're not going to cause jitters, but they do a great job of enhancing the body's ability to naturally manage stress, and also help support mental endurance and metabolic efficiency. The great thing about the ginseng plants is that they can help promote healthy energy and stamina, and as well as healthy stress resilience. Now, the one thing about adaptogens is that they do need to be taken for a while. And so when we look at clinical trials, for example, several research studies have shown that Eleutherococcus and Siberian ginseng can reduce the severity of fatigue syndromes at 2,000 milligrams daily for about 8 weeks. So it can take at least 8 to 12 weeks to begin to see a sustained effect with adaptogenic herbs. But this is a great option to help support your patient's stress response. As we talked about, as Dr. Cho mentioned earlier, supporting that HPA axis is quite important when working with patients with chronic fatigue syndrome. So yeah, that is my go-to. And I'm sure combining the two is pretty helpful and supportive for patients.
Absolutely. And I love the adaptogenic herbs. It is those are always, as a functional medicine provider, those are always like a good go-to for us, especially with HPA imbalances.
Yes. Oh, we have a really great question. How about gut or intestinal absorption? Will that matter with the recommended supplements? Dr. Cho, I'll definitely give you space to answer it, and then I'll jump in.
Yes. So let's go back to that nano quicksilver. A lot of times, because it's going to be sublingual, that can be one of the routes of the formulation that is going to help with more absorption for that. So with the Eleuthero, right? If you're suspecting issues with their absorption or digestion, then there are Eleuthero tinctures as well that you can also try to do sublingually for them. It might sting a little bit, but that might help with the absorption for them. Did you have anything else to add to that, Dr. Sarah?
Yeah, that's exactly why I brought up the nanoemulsification versus, the tablets, because some formulations of supplements can help support absorption. So I agree, sublingual, um, and also kind of considering which patient population generally may have an issue with good absorption and gut health. So patients, we talked about it earlier, patients with gut dysbiosis often tend to also have chronic fatigue syndrome. So when planning out your protocol, you may choose to support the gut first and then follow up with some of these strategies that we mentioned tonight. But in order for our strategies and treatments to be the most effective, we do want to make sure that we're supporting the gut and making sure that they're able to absorb the nutrients that we're giving them.
Absolutely. Great question.
Yeah, really great question. We'll hang out for maybe a few more seconds if anyone else has any other questions. So glad that you all joined us tonight. Anything else you wanted to share, Dr. Chill, before we sign off?
I think one of the biggest thing, we went through the different factors, is to understand that there are multiple factors for chronic fatigue syndrome. And our job is to really investigate all of those contributing factors. That's why it's really important to kind of go back into your modules and your lessons and to see which body systems are all connected. And obviously all of them are connected, but what is contributing to the chronic fatigue, and then figuring out when there is an imbalance in that particular body system, what you can do about that.
Absolutely. This is one of my favorite things about discussing like chronic or complicated conditions like this, is that we can go back into the program and log into the platform, and there are several different modules that kind of touch on and expand on things that we've touched on tonight. So definitely take a moment to log back in. If you haven't already decided to join us, head on over and check out the program, the Advanced and Clinical Functional Medicine program. And we're looking forward to supporting you in your journey.
And an easy tip for people who are going back and going into the modules and lessons is actually just look up fatigue. On the top right-hand corner, there's a search bar. And if you just look up fatigue, all of the modules and the lessons that are associated with that will pop up.
Absolutely. Wonderful. Well, thank you all for joining us. We are so excited to join you all next week for another episode of the Functional Solutions podcast. I hope you guys have a great day and a great evening. Take care.
Bye, everybody.